When it comes to how pain and fatigue can impact your treatment or treatment options, there's two things that your medical oncologist will look at, among many, is regards to how well you're responding to the treatment or how your body is handling the treatment. And those are ejection fraction and performance status. Let's take a look at those two things. So your ejection fraction is a test that kind of gives us a general idea of the health of your heart and the pumping ability of your heart. So the ejection fraction is actually the amount of blood that's pumped out of your heart's lower chamber when it contracts. So it comes in a fraction, and a fraction of 50% or above is normal. So your physician will watch your ejection fraction, and if it starts to drop below 50, they may have to stop the chemotherapy. Performance status is a scale of 0 to 4 that gives us a general idea of how well somebody's functioning in their daily activities. So a 0, this is one of the few times in life you want to be a 0, is somebody who's completely normal and can carry on any ADLs. They can go to work, they can do whatever they want without restriction. As you go up higher in the scale, a 1, 2, 3, or 4, people become more restricted, where a 4 then is somebody who is completely disabled and cannot carry on any self-cares or are confined to bed. So the stronger and healthier and more and better performance status you have, again, you're going to be able to tolerate more chemotherapy, and you're going to have more chemotherapy or more radiation or more treatment options. So performance status is also important. Now, the key point here is both your ejection fraction, your pumping of your heart, and your performance status are modifiable. So if they start to get kind of crummy, there are things that you can do to make them better. And we'll talk about those things. So now let's talk more about pain. Where is the pain coming from? Because many people with metastatic breast cancer have pain, but let's find out where it's coming from so we know how we can treat it or make it better or what we can do about it. So sometimes the cancer itself can cause pain if it's pressing on a nerve, or it's bothering one of the vertebrae in your back, or it's in your femur of your leg. Okay? It can be some of the medications. Sometimes aromatase inhibitors can cause joint and muscle aches. Sometimes the chemotherapies themselves can cause pain. Sometimes people have leftover pain from a surgery that they may have had months or years ago. Or even maybe a previous radiation site may still be causing pain. So figure out where the pain's coming from, because then that helps us figure out what can we do about it. Is this pain fixable? Can we radiate that bone to make the pain go away? Can we medicate it to make it better? Can we not make it necessarily better, but can a medication mask the pain so even though it's still there, you can't feel it? Or can we fix it? If you have post-surgical pain or post-radiation pain, can you get into a rehabilitation therapist and have them stretch you or strengthen you to make that body part not hurt as much anymore? And then another really important thing to figure out is if you have that pain and you maybe can't make it go away, will activity make it worse? Or will activity make it better? Because even if you have a pain, worst case scenario, that you can't make go away, or is going to be with you for a long time, can you still be active? Even though you have pain, I'd rather you be healthy and strong and active than be in pain and be stuck on the couch. So these are all good things to talk to about with your physician, nurse, and rehab therapist. And again, treat yourself like you are the most important person on the planet, because you are. And again, please don't think or just assume because you have metastatic disease that you are supposed to be miserable. Yes, there's going to be times when you're miserable, but that should not be all the time. I actually help run a triathlon training program for female cancer survivors, and every year some of those survivors that come screaming across the finish line after swimming, biking, and running have metastatic breast cancer. So you don't assume that you're supposed to be miserable or can't be healthier than maybe you are.